Welcome, I'm Dr. Seth Rosenzweig, board-certified orthopedic surgeon, part of Louisiana Orthopedic Specialist, Acadiana's leader in orthopedics, spine, and sports medicine. We're also proud sponsors and supporters of the Acadiana local high schools and the University of Louisiana. This video will demonstrate to you the treatment of a common sports injury, the expertise needed to treat it surgically, and the successful recovery once completed. All right, so we got an 18-year-old baseball pitcher going into his senior year, been having a lot of posterior elbow pain, and it took us a little bit to get to this point because he would always point to the triceps, but it really over time we discovered that it was really his ulnar nerve that's getting very irritated. And I'm trying to see if he's got a snapping triceps, which is an uncommon thing, but that means the medial head sometimes will snap with the ulnar nerve. I'm not getting that on exam, but when I push his ulnar nerve, I can feel a little fasciculation. So that tells me his ulnar nerve is definitely irritated. I can feel the forearm trying to jump a little bit. So we're gonna move this nerve. I'll re-examine him. If for any reason I think that triceps head is bothering us, I'll do a little debridement and centralize it. So this is, look how irritated this nerve is. Thank you. It's sitting, here's his epicondyle. Most ulnar nerves will sit a little farther down. His is riding the epicondyle. So you see how easily it's getting irritated. Look at all this vasculature. That is an angry nerve. So we're gonna move it, I'm gonna free it up, and we're gonna move it up here so that this kid can finally get some relief. So I've isolated his ulnar nerve. This is where we started, right there. This is where we're gonna put it. I've got his cutaneous branch isolated. Now this is his triceps, definitely a thick triceps. So when I'm done doing this, I'm gonna move this arm. I wanna make sure it doesn't pop over the side, and it rides right up to it, but it's not popping over. So I don't wanna play with this triceps if I absolutely don't have to. So it doesn't look like it's popping over the epicondyle, and that's what you worry about. So when we're done, I may actually just imbricate it down a little bit right here, but I don't think I'm gonna debride this gorgeous muscle belly right here. So we'll bring you back in once I get this transposed. So I've transposed the nerve, and I do a submuscular fascial flap. You can see some of the fascial band here, and then a nice muscle below and above it. And the key to this is, I really wanna make sure that nerve, you see how nicely it can glide? What you don't wanna do is kink it right here. So look how nicely, no tension under this. And then when I move the arm, again, triceps perches, doesn't snap, but gorgeous excursion. He's gonna do well with this. And I may just throw a stitch or two to centralize his medial head more to the central head, just so it doesn't ride up over top. So medial epicondyle, medial head of the triceps. I've done about 3 or 4 sutures, centralizing this to the central head. So watch, when I flex now, you see how it doesn't come up to the epicondyle? We can compare it to the previous video. But now our medial head stays more central, so he won't have any irritation of it coming up over here. Nerve nicely transposed. Thank you for watching. Please subscribe to this channel to watch more of my videos. If you have joint pain or a sports-related injury, I'm here to help. I want to help you live your life to its fullest.